Mental health, if you look at overlays of what's occurring, there's the line of mental health, anxiety and depression diagnoses that have scaled up, they follow the same exact pattern as the prescribing of these medications. Now, over 50% of the addicted, that number is higher, that's an old stat, have an associated mental health issue. Diagnosis of anxiety parallel, 24-hour news cycle, social media, competitive success syndrome, cyberbullying, false sense of community, rat park. What does that all mean? It's like, we're not what we were before. How many people grew up with 3 or 4 family members that had houses within, 20 minutes of your block, your tribe? You had your tribe, like you had your family or close friends. And we don't see that anymore. And you can have 1,000 people. I have too many Facebook friends, but nobody shows up when I need a helping hand except a handful of those family members. People have this false sense of what their community's like. Rat park is an interesting thing. I'll just tell it to you briefly. The study, if you look it up too, you can see some of the information on that. There was a single rat that's placed in a cage, and there's a bottle of water and a bottle with morphine-laced water. So that single rat in isolation eventually goes to both and then to the morphine and then does it so much it overdoses and dies. Rat park is a room the size of this with a couple of hundred rats, spin wheels, they can have intimacy, plenty of food. It's like utopia for the rat, right? So the same 2 bottles are placed in there. They go to the morphine-laced bottle once, twice only by accident, and never return to it again. Like, that's pretty big. Why would I want to change my sense of utopia? I have what I need. Why would I change that? They don't. But the isolated rat in a cage doesn't want to be alone. There's nothing left for that person except changing or altering that perception of reality, and they will go to that laced bottle over and over and over until they're gone.